Ever wondered how Ozempic fits into the weight loss and dieting world? Today we're going to unravel that mystery. First off, let's get to know Ozempic. It's a prescription medication designed to manage type 2 diabetes. But here's where it gets interesting. Ozempic has also been found to aid in weight loss, serving as a beacon of hope for those battling the bulge. It works by mimicking a hormone in your body, which regulates appetite and food intake, thereby helping to control blood sugar levels and leading to weight loss. Now let's briefly touch on the concept of weight loss and dieting. For many, it's a journey filled with challenges and triumphs. It's about creating a calorie deficit, where you burn more calories than you consume. It's about making healthier food choices, staying active, and maintaining consistency. And for some, it might involve medications like Ozempic. But why diet? Well, it's not just about looking good, it's also about feeling good and being healthy. From reducing the risk of chronic diseases to boosting your mood and energy levels, the benefits of a balanced diet are far-reaching. So, where does Ozempic fit into all of this? It's essentially another tool in the weight loss toolbox. While it's not a magic bullet, it can be a useful aid alongside a calorie-controlled diet and regular exercise. Remember, it's always best to consult with a healthcare professional to understand if Ozempic is the right choice for you. And of course, it's important to note that while Ozempic may assist in weight loss, it's not a standalone solution. A balanced diet and regular physical activity are key to achieving and maintaining a healthy weight. It's all about finding the right balance that works for you. Now let's delve a bit deeper into the role of Ozempic in weight loss. You've probably heard about the keto diet, but how does it compare to Ozempic? Let's delve into the comparison. Ozempic, a once-weekly injectable medication, works by mimicking an intestinal hormone that targets areas of the brain regulating appetite and food intake. Many users have reported significant weight loss over time. On the other hand, the keto diet is a high-fat, low-carb diet that shifts your body's metabolism away from carbs and towards fat and ketones, leading to weight loss. It's gained recognition for its quick results, but it's not without its drawbacks. While Ozempic is generally well tolerated, potential side effects may include nausea, abdominal pain, and diarrhea. Keto, too, is known for the infamous keto flu, a set of symptoms like headache, fatigue, and nausea that can occur as your body adjusts to its new energy source. As for effectiveness, both have shown promising results. However, it's crucial to remember that what works for one person may not work for another, as our bodies respond differently to different weight loss strategies. While both have their merits, it's important to understand how they differ. It all boils down to personal preference, health conditions, and lifestyle when choosing between Ozempic and the keto diet. Don't just take it from us. Hear what medical professionals have to say about Ozempic. Let's first hear from Dr. Jameson, an endocrinologist with over 20 years of experience. In my practice, I've seen Ozempic help many patients control their blood sugar levels and lose weight. It's not a miracle drug, but it's a useful tool in the toolbox for treating type 2 diabetes. Next, we have Dr. Lopez, a dietitian who specializes in weight management. Ozempic can be effective, but it's not a substitute for a healthy diet and regular exercise. It can help kickstart weight loss, but lifestyle changes are still critical. Dr. Patel, a cardiologist, shares his perspective. Many of my patients on Ozempic report some gastrointestinal side effects, but these often diminish over time. It's important to monitor for potential heart risks, but overall it's a promising option for certain patients. From the field of general practice, Dr. Smith adds, Ozempic is a good option for many, but it's not for everyone. Patients with a history of certain conditions like pancreatitis or thyroid cancer should avoid it. Always discuss your medical history with your doctor before starting a new medication. Lastly, Dr. Huang, a pharmacist, provides a cautionary note. Like any medication, Ozempic can interact with other drugs. If you're taking other medications or supplements, be sure to discuss this with your healthcare provider to avoid potential interactions. Collectively, these professionals highlight that Ozempic can be an effective tool for managing type 2 diabetes and supporting weight loss. However, it's not a one-size-fits-all solution and should be used as part of a comprehensive treatment plan. It's crucial to discuss your individual health needs and circumstances with your healthcare provider to determine if Ozempic is right for you. As you can see, the medical community has varying opinions on Ozempic. Another player in the weight loss field is Wegovy. But how does it stack up against Ozempic? When you look at the two, you might think they're twins. Both Ozempic and Wegovy are injectable medications that work by mimicking a hormone in the body that regulates appetite. But there's a twist. Ozempic, primarily used to manage type 2 diabetes, has been found to aid weight loss as a happy side effect. On the other hand, Wegovy, a newcomer to the scene, is designed specifically for weight management. In terms of effectiveness, studies show both offer significant weight loss benefits. However, Wegovy has shown slightly more promising results in clinical trials, with users losing about 20% of their body weight on average, but, like any medication, both come with potential side effects. Ozempic users may experience nausea, abdominal pain, or even changes in vision. Wegovy isn't without its drawbacks either, with side effects ranging from fatigue to constipation. Both Ozempic and Wegovy have their own pros and cons in the weight loss journey. So, as always, consult with your healthcare provider to decide which might be the best fit for you. So, where does all this information leave us on Ozempic? Well, let's summarize what we've learned. Ozempic has shown promise in aiding weight loss, but it's not a magic bullet, and it does come with potential side effects. It's a prescription medication, unlike the keto diet, which is a lifestyle change that anyone can adopt. In comparison to Wegovy, another weight loss drug, Ozempic holds its own. Both have their pros and cons, and the choice between the two will largely depend on personal health factors and your doctor's advice. From the interviews with doctors, we've learned that Ozempic can be a helpful tool in the weight loss journey, but it shouldn't replace a healthy diet and regular exercise. It's also important to note that while Ozempic can help with weight loss, its primary function is to manage type 2 diabetes. In the end, the effectiveness of Ozempic, like any weight loss method, depends on the individual's body, lifestyle, and commitment to their health journey.